Hello and welcome to Healthy Knees for You. My name is Robin Robertson. I'm the founder of Healthy Knees Coach. And today we're wrapping up our interview with Dr. Thorpe and talking about the last two of the 4 knee pain relief injections that you can have. Injection number 3 is platelet-rich plasma, or PRP, and injection number 4 is stem cell. Do they work? Check it out.
How about platelet-rich plasma? What is that stuff? Where do you get it? And what is it supposed to do?
Well, we get it from you, the patient. So we would draw your blood, we would put it in a centrifuge in the office, spin it so that the platelets and the white blood cells and the red blood cells settle out into different layers. And so that's what platelet-rich plasma is you take the part of the plasma that's got all the platelets in it. And you can get, there's 2 basic types of PRP, is leukocyte-rich and leukocyte-poor. Leukocyte is the medical term for a white blood cell. So there'll be this kind of white area, which is the white blood cells, and if you take the platelets with the white blood cells, that's called leukocyte-rich.
Okay.
You don't want to use that in your joints. Because white blood cells, like with pus, help degrade cartilage. So you do not want to inject leukocyte-rich. You want to take leukocyte-poor, where you get mainly just the platelets. And then that would be injected into the joint. The science on that is still forthcoming. There's people that are becoming more and more believers of that for arthritis. There's a lot of anecdotal stories like, I had this and it's great and I feel wonderful, but you always have to remember there's the placebo effect. You just paid $500 or $700 for this. You hope it works, and by gosh, it works. And then they come tell us that they had it and it worked great. And the placebo effect is around 25 to 30% of people. If I give you a pink jelly bean and say, take this every day and your knee is going to feel better,
might.
A third of the people are going to say, I do feel better.
It is amazing how much power your mind has over pain management. And I had PRP shots and injections in both of my knees before I had knee replacements, and I felt like it really helped. It bought me 6 months, 9 months, and then I was back to my normal levels of arthritic knee pain. So whether or not it was a placebo, who knows?
Who knows? And so if it's not a real costly or dangerous placebo, that's okay. Insurance companies thus far are not paying for PRP, to my knowledge.
Right.
They weren't when I retired a year and a half ago. And so we tried to, in our office, we were doing it mainly for tendonitis though. Like if somebody had jumper's knee, patellar tendonitis, or quadriceps tendonitis, rotator cuff,
tennis elbow,
things like that. We would draw their blood, centrifuge it, and give them the injection in the office. Pretty uncomfortable injection into a tendon because there's no space, right? You're injecting this stuff into a tendon, and it's thick. And so fairly uncomfortable. But the science on tendonitis is growing. It's getting pretty good. And I know a few people personally that they did everything for their quad tendonitis, had one injection, and it was gone.
Okay.
So
that's awesome.
And these are straight shooting people that I know. And so tendons, more indication for that for tendonitis. Knee joints, the jury's still out, I'd say.
I had PRP done as trying to put off that ultimate knee replacement, and it bought me more time, which is really what I was shooting for, because I wanted to push it off until I was 56 when I had it, because I figure that when I was 56, if my knee lasts 22 years, then I'll be 78. And then it'll last 22 years more, then I'm 100, and I'm dead, and that's fine. So
I thought you were 39 now.
Yeah. I'm 30.
Oh, yeah, 30. So,
all right, so cortisone, HA, PRP.
I've never done a PRP injection, but I know people are doing those and trying them out. And then stem cells is
stem cell, that biggie that everybody is the great hope for biomedicine.
The great hope, yes. Again, no good studies to say that that's of value. I'm not aware of any insurance companies paying for it. There's stem cells and there's stem cells. So the best stem cells you could get would be from infant umbilical cords. Pretty hard to get, controversial.
Yeah.
You know,
usually frozen then, right?
I would assume. I have no experience giving them, but I would assume it'd be frozen. Stem cells from our own body would be from your bone marrow. Well, nobody's going to want a bone marrow aspirate, you know, a sample out of your bone marrow. So they tend to get it from your own fat. Well, abdominal fat, which some of us have, and some of us have more of, does have some stem cells in it, but they're really not going to do anything. They're few. They're not young and active enough. Of course, the older you get, your stem cells aren't going to all of a sudden, I need to become the liver. I need to become the spleen. You know, they're not pluripotential anymore. I've heard that the best stem cell source in us is the fat within our knee. Again, how good is it in harvesting it, you know, and all that.
Yeah.
So it's kind of iffy.
That seems awkward for harvesting.
Yeah. And, you know, when stem cells were first brought up, all these clinics were opening up around the nation, not even by orthopedic surgeons who are kind of the experts of this stuff. They'd be, you know, who knows what type of doc or not doctor, and they were offering it $10,000 a shot, and it was really disappointing. And our American Academy of Orthopedic Surgeons lobbied the government to put an end to that. And you have to be credentialed. You have to be, you know, not selling snake oil.
Right. And, you know, I know some people who've had injections and had actually really good results. And I know people, me included, who had an injection and no difference. And it's a big amount of money to gamble with.
Yeah.
And so, you know, if you have $5,000 or $10,000 that you can gamble with and will follow the recovery instructions from it, I think that's probably one of the reasons I had zero results, is because I was too active on my knee afterwards, thinking that I was problem solved, but it wasn't. So I think jury is out on stem cell.
Yeah.
Potential,
I'd say, you know, we're all hopeful. There'll be
Yes.
things where nobody needs a knee replacement. That would be wonderful.
Oh, yes, it would.
But we don't want people to be hoodwinked into thinking that if I go get a PRP or a stem cell injection, that's going to be the cure, worth the money, worth the travel. You know, you just got to look for reputable advice.
Yes, and look for results too. Find out what the results are, not just if you're looking at a certain clinic. They're, of course, going to tell you all of their great results, but go into some of the peer-reviewed studies that you can look up online about stem cell application in knees and see what you can find too before you follow that marketing sales pitch, because there's a lot of them out there for stem cell right now too. And again, I'm going to go back to the other things that you can do for pain relief in your knees are kind of boring but very effective. Get stronger first. So do the training that's going to help your knee be better supported by all of the muscles involved, from your ankles to your core, because your knee depends on the action of all of those joints as well. So strength training, strength training, strength training is what I always come back to. And there are always things that you can do for almost everyone in any condition. All right, thank you so much for sharing this time with us. I look forward to sharing knee news with you every week. I hope that you'll subscribe to the channel, Healthy Knees for You. I post a new video every Thursday, and I look forward to seeing you again next week. Take care.